Did you know that there is so much more about sperm health than its count, motility and morphology? And just because there is a normal number of sperm in a sample and perhaps they're swimming adequately and shaped somewhat normally, you may need to question the prognosis of your doctor of just keep trying, everything is normal. Because in the meantime, what is your sperm fragmentation result? What is your anti-sperm antibody result? And what is your sperm culture result? Those are all important questions that we need to ask. And most importantly, what are you planning to do about those results? Do you have a winning strategy that is proven and that can help you overcome infertility and miscarriage even when other treatments have failed? And if you're not quite sure about the answer to any of these questions, well, this Ask Gabriela Rosa episode is exactly for you. So welcome, I'm Gabriela Rosa, I'm a fertility specialist. I'm also a Harvard University awarded scholar, and for the last 2 decades I have helped couples overcome infertility and miscarriage even when other treatments have failed. And now we have taken over 100,000 people, in fact it's been over 140 now, 1,000 people, through various programs in more than 100 countries, and through all of those adventures that we've been on together with different couples in different situations, there's lots that I've seen and lots that I've learned that I think can help you on your journey as well. What's interesting is that in our practice we specialize in treating very difficult and complex cases, typically from people who have tried lots of different things and nothing has worked so far. But what is a common theme amongst all of the patients that we treat is that typically male fertility is almost ignored. To a certain extent, men are unfortunately ignored on the fertility journey, not in our clinic and certainly not in the way that we work. And that has proven to be extremely beneficial because our latest results show that our patients in the Natural Fertility Breakthrough Program, 78.15% of them take home live, beautiful, healthy babies. And so we know that there is something different in terms of how these couples are being addressed, especially when they do feel like they've tried everything and nothing has worked. Many of our patients have gone through multiple failed IVF cycles and done lots of different things, different treatments, natural and otherwise, to conceive, and of course hadn't gotten quite there yet until they found some of the extra missing pieces that hopefully is part of what I'm going to be sharing with you today so that you can get a different result as well. Okay, so that's essentially what we're going to be doing. Before we do get started, I always like to know, hello, where are you watching from? It's lovely to be able to connect. These sessions are amazing in terms of understanding exactly what it is that you guys need throughout this conversation. So please, let's make it a conversation. Feel free to write down any questions in the comments. You can certainly connect and reach out to me. We're doing this live on Instagram as well as on Facebook. All of the full video replays stay available in the Facebook page. So it's Fertility Specialist Gabriela Rosa page on Facebook, and you'll be able to find on the video all of the replays. So there's been lots and lots of talks, and in fact, one of the things that I do want to do before we start, because I know and I'm very clear about the fact that you men do get underserviced when it comes to talking about fertility and certainly optimizing fertility and health, male fertility health. And I really want to acknowledge you because being here and also honouring your contribution to the couple that you're in, to the ability that you have to improve and optimize everything that you can do to increase the chances of not only getting pregnant but staying pregnant and taking a healthy pregnancy to term. Like I said, the way in which often patients come to us and I say, can you please send me through all of your results? And I'll have pages and pages and pages and pages of things for women, not necessarily all of the things that I need and certainly many gaps, but often I may not even have a semen analysis for the man. And it's like, well, hang on a second. This is a 50-50 equation. We do need to optimize both sides of this equation if we are to actually get a result and get an optimal outcome here. So I really want to acknowledge you. If you're watching this, kudos, because you understand that there is more. You certainly understand that there is very much a part of you that can be contributing to this, and it's absolutely amazing to have you do just that. And hopefully in this talk today, I'll be able to share some light and insights that are really going to help transform your journey and really optimize what's going on for you. Now, in terms of male fertility, there are, like everything, I think there are ranges of how things operate. You have the couples who come to us where they are azoospermic, there's absolutely zero sperm, and we know that from the outset. Then there are couples who basically are told sperm is fantastic, never seen anything better. And yet, we are still holding on to the same outcome, which is the lack of a baby. So what is it that makes that puzzling? To me, certainly over the years, I have questioned it many times, because it's like, okay, well, if you're saying that everything is normal, if everything is fine, if the sperm is heroic, which hopefully it is, and if it isn't, there are many things that you can do about it. Why is it that we still don't have a healthy pregnancy to term? And unfortunately, it would be nice if we could just pass the bucket on to your female partner. Unfortunately, it doesn't quite happen that way. And I've talked about this concept a few times before, and I will share it again in terms of why the male contribution is so essential to the ability of taking home a healthy baby, especially when perhaps we do have a known reduced ovarian reserve or poor egg quality, or we've experienced miscarriages in the past. I mean, we now know via the science that there is around all of this that there are 50% of the reason as to why miscarriages occur is because of sperm and sperm health. So we certainly are much, much further forward. When I started doing this 20 years ago, there was still this kind of stigma that, if a couple couldn't conceive, it was a woman's issue. Well, now we understand that if a couple is still not holding the healthy baby of their dreams in their arms, it's because there is more to be done, and that more really does fall into both prospective parents' camps, so to speak. And so today, I really want to talk about, take this to another level of conversation. I did a talk about sperm health, and certainly very specifically going through sperm parameters, specifically things that can be done to optimize sperm health, and I'll be touching on those again today. But I would highly recommend, I want to make this talk a little bit more advanced than was the first talk. And so what will happen is, if you haven't actually watched the other talk yet, that's perfectly fine. What I would recommend though is that you do search it out in the Fertility Specialist Gabriela Rosa Facebook page. So if you just search that in Facebook, Fertility Specialist Gabriela Rosa, and then you will find that page, and then you will probably, whilst you're there, I would recommend that you like it or follow it, because all of this extra new content that I put out, I actually put out through that page, even though there is the Natural Fertility Breakthrough page as well. But all of the AGR videos, which are the Ask Gabriela Rosa episodes, they're actually in the Gabriela Rosa Fertility page. Long story short, on your computer, if you go to videos, you will see all of the replays of the previous videos. I would recommend, you can certainly watch this after, so watch this first, and I'll reference some things that are going to be important. Also, at the end of this talk, I always do this at the end because I want to make sure that you guys are paying attention whilst you've got me. And if you have questions, that you're asking your questions, whilst we are here. So at the end of this talk, I will put up a handout as well about, for this particular talk, where there's lots of references. So all of the things that I talk about, all of the points that I make, they're all going to be referenced in this handout with the scientific evidence and the literature and everything else that you need, as well as some extra recommendations and things that you might find useful along the way. So that's pretty much how we're going to get started. So yay, hello, we've got Ashley and Rima and Kadra. Hi Kadra, lovely to have you here, my darling. So yes, let's get straight into it, and it's lovely to be able to connect with so many of you. So a couple of things, and one thing that you need to know, this topic is massive. All of the topics that I actually tackle in Ask Gabriela Rosa, they are huge topics, and sometimes, you know, when we're doing kind of education on a general level, it's difficult to drill deep into each specific case. So that's where, you know, if you wanted to get specific advice or a second opinion on your case, by all means reach out to my team. I do all of the assessments in the clinic to make sure that, you know, we can actually support a couple or not, and, you know, happy to discuss if we need further information or further resources there. But ultimately, for this purpose of being here right now, there are many different questions that I get asked all the time about fertility. And see, these are some of the basic questions, and I'll just go through it because I will tell you exactly where you'll find these answers. So what do we do? So what does each sperm parameter mean? So I will actually go through that again today because it's a good little revision for everyone who hasn't watched this before. And even if you know, it's good for you to have a little bit of a further knowledge and understanding about this. Is ICSI and IVF the only option if we have abnormal sperm parameters? And again, this is a great question. I'll definitely be going through that. Is there anything that a man can do to improve his sperm quality? There are lots of things that a man can do, and the male fertility talk that I've mentioned before would definitely be something that that it would be good for you to be able to watch at some point, because in there I go through great detail in terms of how and what. Does the health of sperm matter if we have good ovarian reserve? And what's interesting here is that you might be asking, well, why does sperm have anything to do with ovarian reserve? Let me just get that one out of the way straight away. And I've talked about this in great depth in the egg quality webinars that I've done before. But I'll just quickly reiterate it because I think it's an important concept to understand. You see, it's the egg's responsibility to ensure that the sperm that is going to penetrate it and fertilize it and be able to actually begin that whole development of an embryo is, one, the healthiest quality possible, but also that it most closely resembles a match for the DNA within that particular egg. So there are chemical signals that basically ascend by the egg to attract a specific type of sperm. So that's where we miss out on that kind of biological interaction when we just bypass things and go straight to ICSI, for example, because there you're getting a scientist looking at, you know, sperm under the microscope going, okay, that one's moving, let's just take that one and put it inside the egg. And, you know, there is evidence that ICSI does increase the risk of a whole lot of childhood developmental issues. So, you know, a small increase, but certainly an increase nonetheless. And so we need to start questioning, okay, well, what does it mean if we're bypassing biological pieces of reproduction for the long term, right? For not only this generation, but generations to come. And these are also important questions that we need to consider. So when things aren't necessarily going to plan in terms of fertility, in my opinion, it's important to ensure that we are addressing some of those foundational issues and foundational aspects that are causing that result to begin with. Because as I always talk about, fertility is a biochemical chain reaction. So the result that we see over here, which might be, you know, lack of sperm, might be, you know, a miscarriage or an inability to conceive or a whatever it is, right? It's a result. It's a result of a whole lot of steps that have happened biologically and biochemically prior to this result actually showing up. So when this is the case, we need to question, okay, what are all of the things that I can do to optimize each step of this biochemical chain reaction? What's fascinating is that in terms of fertility, we see very, very little, unless you go through IVF, which you see a little bit more about all of the stages and the steps that, you know, the egg has to go through to then become able to be fertilized, to then actually develop, and, you know, all of those steps. So you're getting a call. If you've had an IVF, you're getting a call, how many eggs you've got, how many matured, how many actually were able to be fertilized, how many survived past day 3, how many were there, you know, at day 5, you know, how many are able to be transferred and what grade they are. So, you know, all of those steps biochemically, typically we don't see them. And so we often forget that they even exist. So it's nice to be reminded to a certain extent that, you know, these things do happen and they do exist, but also to understand the level and the impact that you can have in every step that is required to get to the result. Because here's what happens. Because the egg is responsible for ensuring that there is a match in the DNA, but also that it utilizes some of its own inner energy resources to optimize and fix some of the DNA fragmentation and DNA issues within the sperm, what happens is that it's reducing the energy that it actually has to be able to do all of the biochemical processes that are required to not only be fertilized, but then for an embryo to develop and continuing developing past a certain stage, right? So what happens is that if the sperm is not the absolute best quality that it can be, then what's going to happen is that it's going to bring the team down. It's, you know, the best way to describe it. You know, I always talk about the fact that fertility is a team sport, and it is a team sport for a reason. You do need two prospective parents to make this happen. Even if you're going through solo reproduction, you still need quality sperm. So all of these factors are going to be really important when we're discussing the impact of quality sperm versus sperm that's not so great quality versus sperm that's actually poor quality versus a biochemical reaction that's creating some kind of sperm production issue, for example, right? And sometimes these sperm production issues that relate to and certainly cause azoospermia, for example, can be addressed. Sometimes they can't. Sometimes if they're genetic, obviously it's going to be, you know, a very difficult situation. Like we've had people with Klinefelters before who basically came in because we wanted to optimize as much as we possibly could the sperm so that we could go and do ICSI, and, you know, that basically is something, and obviously sperm extraction becomes really important in different ways of doing that. So that's one way, and certainly it's one way that's available, and sometimes it's necessary. But the reality is that for most people, that's not the reason as to why sperm quality is decreased. Often, and, you know, really in it's almost best case scenario, what happens is that the sperm is highly sensitive to dietary factors, lifestyle factors, and environmental factors. So that being the case, every single thing that you do, even much more so than egg quality, because egg quality, yes, it's impacted by all of those lifestyle factors, absolutely. But sperm is impacted very, very directly. And also the impact to sperm of these factors actually happen much quicker, right? And also addressing it and improving it happens faster than it does for the egg. It takes about 8 months for an egg to go from primordial follicle to primary follicle, which is basically, I beg your pardon, to ovulatory follicle. So from primordial follicle, which is the follicles that we were ever, you know, always born with and that we ever had as women being born into this world, we're born with all the eggs that we will ever have. Of course, this conversation will change in 20 years from now when stem cells and, you know, all of this research is finalised. But right now, we're born with all the eggs we'll ever have. And so what happens is from primordial follicle to primary follicle takes 4 months. So that's a period that it takes. From primary follicle to ovulatory follicle takes another 4 months. So that's an 8-month maturation cycle. Whereas for sperm, typically we're looking at a 3.5-month maturation cycle. So every 3.5 months you have completely new batch of sperm. Okay? Now, what does that mean? It means that the speed in which you can optimize sperm health actually is faster, but also it can take up to 3 to 4 sperm cycles to see fully the impact of a behavior to an outcome. So, for example, if you drink, do drugs, smoke, and, you know, you're, it is complicated, Kadra. That's why you hire us, and you did. But basically, the whole thing about this is that it takes, you know, that whole time in order for things to actually be optimized. And so one of the important things that is really, really vital to understand is that when it comes to making differences, and like I said, if you drink, smoke, do drugs, you know, all of these things, you are going to have, the body's going to take a bit of time. If you're overweight, right? So let's just talk about, you know, all of these kind of lifestyle factors that are things that you can actually make a difference to. And mind you, I'm going to be talking, my 3 big ideas today are 3 different types of investigations that I'm sure most of you listening in today have not done. Okay, and I'm going to talk about what they mean, how they're relevant and related. Right now we need to go through a little bit of context so that you understand. But you will see in the moment when I talk about lifestyle factors, and you will see based on all of the research that's currently out there, you will understand that these lifestyle factors, they're not just kind of like, oh yeah, whatever, you know, I drink, I smoke, it's fine. You know, my sperm is okay. Your count, motility and morphology may not have been affected yet. It will be. And so this is the thing that you need to understand. However, your DNA fragmentation, your sperm antibodies and culture to a secondary extent, although there are some factors there in terms of lifestyle that definitely will impact culture, and I'll talk about that in a minute, and that's sperm culture, I'm not talking about your general culture. But you know, those 3 things will absolutely be impacted in a way that often is unseen. And so this is the key aspect that is so vital to take into consideration. There are things that you know, and these are typically the things that if you've had a general sperm analysis, semen analysis, you'll be told, oh yeah, your sperm is okay. You may even be told, oh my God, your sperm is amazing. I've never seen sperm so great. Fabulous. And I'm a little bit facetious on this because, you know, it's typically male fertility specialists that will tell their male patients how amazing their sperm is. And it's questionable, right, in the majority of cases. Again, what I always go back to is, what does life demonstrate? Do we have a baby? If we don't have a baby, we have more work to do. So, and I'm not being gender biased here, I'm just saying what it is that we normally see, right? And this is essentially what happens. But ultimately, all of these lifestyle factors will certainly have an impact. And, you know, like my mother's cardiologist once said, I love my mother's cardiologist. So my mum goes through yearly kind of checkups, because it's just like the thing she does, right? She just likes to make sure she's very proactive in terms of her health. So she goes for yearly checkups and has been doing so for many, many, many years. There has never been one thing wrong with my mother's heart. She's not a hypochondriac, I think, but she really does, you know, want to make sure that she's on top of things. So anyway, this one year, and this was many, many, many years ago, I think it's like 20 years ago, she went to see her cardiologist, and her cardiologist turns around to her after doing all of the tests and doing all the things that needed to be done. And everything was brilliant, perfect, normal, you know, great. So her cardiologist turns around to her, and at the time she smoked cigarettes. And he turns around to her and he says, Miss Rosa, or Mrs. Rosa, whatever it is. Actually, this was in Portuguese, right? Because my parents live in Brazil, so it wasn't really exactly the Mrs. Rosa thing. But this was the message that he basically delivered, which I thought was brilliant. What he said to her was this: everything is normal today. And that's great, but we will be here for you when you are having cardiac insufficiency and or have had strokes and need extra, you know, heart support and cardiovascular support. And my mum was like, you know, basically saying to her that everything was fine today, but, you know, if she continued her lifestyle and her behaviours, that she was going to be needing to come to the cardiologist. So my mother was absolutely appalled by this consultation. She was angry. She was pissed off. She was like, oh my God, how dare that man talk to me like that? You know, that doctor, who does he think he is? Anyway, the very next day, she stopped smoking completely, has never smoked again since in her life. So, you know, sometimes a little bit of tough love. Hence, you know, when she told me this story, I'm like, oh my God, I want to kiss this man's feet. Like, yes. Because no matter what we said to her, you know, over the years, and nothing actually went through. And then, you know, this happened and she was like, oh my God. So let me give you a little bit of tough love. And let's say this, you know, it's very possible that if you don't want to change your behavior now, that's fine. But one day you will actually be faced with much more than just the inability to conceive. And unfortunately, your children, if you are lucky enough to have them, will also have to pay the price of not having a father to grow up with. So, you know, sometimes we need to consider what these things actually mean, not just for the now, but for the long term. And the reason that this is important is this, because what happens is that if we want to optimize your ability to take home a healthy baby and your children's health in the long term, we don't do that by essentially, when they're pregnant, giving them good vegetables to eat, or, by through the mother, or when they are, born, make sure that they have the best nutrition. We do all of those things by optimizing every possible biochemical step that we've talked about up until the point of conception and beyond. So all of these steps, everything that you do there is going to optimize the chances that you are going to have the healthiest possible sperm. And this, it can't be underestimated, because it is not just so much about, again, like I said, there is so much more to it than just count, motility and morphology. So count relates to the number of sperm that are actually there. Then, of course, we have morphology, which is the shape of the sperm. And then we have motility. So morphology, sometimes when the shape of the sperm is abnormal, what will happen is that it will negatively impact the ability to fertilize an egg, but it may also even impact the ability of that egg of that sperm to swim. And the same obviously applies to motility. Now, what's interesting, and I've mentioned before, this idea of DNA fragmentation, of sperm antibodies, and also checking out a sperm culture. The reason that those things are important is because they will, at some point, and it might not be immediate, but they will at some point not only have an impact on an immunological base, but they will also have an impact physically on how the sperm is able to perform its functions. So, and of course, depending on what kinds of things we're looking at in terms of the issues around the sperm, the egg won't even be able to actually attract them or engage them. And so these are things that we do need to take into consideration as well, okay? So these are important little concepts that I think if we have those, we can move forward from here knowing that there are some extra aspects to really focus on. So are we good so far? Are there any questions? If you have questions, please do put them on the chat. What I would love to talk about next is, and again, just let's quickly go through the rest of those questions, because it's important to understand these concepts when they come up. So then, of course, supplementation is a big question. What supplements should I take? I talk about this in detail in the Fertility Challenge, so if you haven't yet done the Fertility Challenge, I would recommend that you do that, and or see a practitioner for extra specific information here, because, self-prescription is never going to be the ideal thing. So definitely make sure that you have a further look into that with a professional that really understands what it is that you need to do there. And then, of course, is there anything that that my partner can do to optimize? What lifestyle factors are important? These questions I have answered in the previous talk, so just make sure that you go and have a look at that. And who should we speak to if we need the best possible guidance on our fertility? And that depends on various factors. Like I said, we treat patients all over the world. So if you need extra support, do let us know. So ultimately, those are the kind of main questions. If there's others, please bring them to the table and I would love to answer them. And, I've already touched on the fact that fertility is a 50-50 situation. Sperm is also responsible for the ability to keep a healthy pregnancy to term. So it's important to understand that if miscarriages and recurrent miscarriages are happening, there are 9 category reasons for miscarriage. I've talked about these categories in a specific miscarriage and implantation failure talk. So again, all on the videos, so you can go ahead and have a look at that. So we won't cover those things here today because I want to really focus on the next 3 big ideas that I want to share with you. But poor egg quality, and this is one thing that I want to drive home. If you get nothing else from this talk, get this. Poor egg quality demands optimal sperm. Okay, because women will be doing everything that they possibly can to optimize their chances, and then we also need to double that up with a male's contribution as well, okay? And then finally, what are minor factors and how do they impact sperm? Now, here's one thing that you need to understand, and once I've covered this, I'm going to go through and I'm going to talk about DNA fragmentation first, okay? But minor factors are typically obstacles that get in the way. What we know, and this is based on epidemiological research from populations around the globe, is that a couple at peak fertility has an average of 3 months time to pregnancy. So literally it's get pregnant, and have a baby, basically. It's have sex, get pregnant, have a baby, done. You know, we're no longer having this conversation. Once we're having this conversation, we then need to ask, okay, what are some of the things that could be getting in the way? And sometimes we have the result, which is, you know, sperm count is down, or motility is down, or morphology is down, or whatever it is, right? But a minor factor can be so many different things, from hormonal imbalances to irregular periods to you name it, you know, all of those factors that I've talked about in terms of sperm. But then we have others as well, you know, potential STIs and infections and, you know, antibodies. All of those different things can essentially count as one minor factor into the equation. Here's what we know in terms of minor factors. When we add one minor factor to the equation, all of a sudden we go from an average of 3 months time to pregnancy to an average of 2 years. So there's a huge compounding effect that goes on. You add a second minor factor, we go to 7 years, and a third gives us an average of 40 years time to pregnancy. No one has 40 years to get pregnant. So really what we need to do is look at all of the different factors that could be getting in the way, and then really focusing on what is the 20% of the effort that will give us 80% of our result. Because otherwise, this is what ends up happening, and I see this very, very, very frequently, is where couples keep going around in circles for a long time and eventually run out of time altogether. So we want to be avoiding this by really understanding what are all of the things. The reason that a lot of couples kind of stay here is because what happens is that they focus on 80% of the effort. They try and do all of these things that are general and not specific to their case, and they expect that that's going to be, you know, they're doing, and this is often why I hear, we've done everything, nothing has worked, right? But you see, one person might need these pieces, another person might need these pieces, and another person might need these other pieces down here. And so what happens is that in order to really optimize and change, transform results, it's about figuring out for a couple what is the 20% of the effort in this specific and customized, personalized situation that is going to give us 80% of our result, as opposed to the other way around, which often happens. You know, often couples are going and focusing on the 80% that will give us 20% of our result, and that is definitely not what's going to support the transition from inability to conceive or challenges, reproductively speaking, to baby. And, you know, as always, I always say, I wish that this was a direct line, you know, from where are we, from there to there. I really do wish that that was the case. If I could figure that one out, that would be pretty amazing. But the reality is that it doesn't necessarily have to be a direct line, as long as we are sufficiently and effectively moving forward. And that is key. And the only way that that happens is actually by understanding what are we dealing with to begin with. Okay? Because a lot of times when you go and have your workup, your doctor will do the bare minimum because that's what's covered by insurance or, you know, Medicare or whatever. And unfortunately, if nothing comes up in that preliminary assessment, nothing else is looked at. And yet, here we have a couple that's been trying for 5 years. So it's like, okay, how does this even work, right? How does this actually add up? And typically what I find is that it doesn't. Until we really go through and look at all of these different pieces, it doesn't add up. And that is crucial. So here's what you need to know. When you have a semen analysis, you must, first of all, that is the number one thing you need to do. You must go to a lab that focuses and specializes in semen analysis results. Here's why. If you just go and see your GP and you go to the kind of like normal pathology lab that takes the blood tests and does everything else, they're not specialists in doing semen analysis. They don't see semen analysis day in, day out, multiple times a day. Semen analysis process is still somewhat of a manual visual process. So literally it's almost like, you know, you have a piece, a circle within a, you know, an area of the microscope, and basically in there you've got the sperm, and you kind of make some extrapolations of count, and you look at, okay, how many are actually moving within this area range, you know, what's going on in terms of, and different labs have different values and different ranges. So always, fertility labs that specialize in andrology, who specialize in semen analysis results, they're going to be using the WHO guidelines, the World Health Organization guidelines. That is what we want, okay? First and foremost, that is going to be crucial. That is going to be very, very important, because then we know exactly what it is that we're dealing with in terms of being able to compare results. You see, if you have a result today and then you go and do another test, you know, I don't know, a year from now, and it's a different lab that uses different parameters, you absolutely cannot correlate those two results. So you don't know in a year from now, 2 years from now, however long from now, whether your sperm has gotten better or worse, or what has happened. What we know is that certainly with age, in the same way that egg quality gets decreased, we also know that sperm quality diminishes. And that's why sperm banks, they won't accept sperm from men who are over 40, because as far as what we understand in terms of science, sperm of men who are over 40 already have a lowered fertilization potential. Now, mind you, that's for the general population out there, okay? For the people who basically do all of the things and act on the recommendations that I give them, that typically doesn't happen. You know, the fertilization potential, the majority of our patients are over 40. So we can improve and we can optimize in the same way that we can improve and optimize sperm egg quality. However, it's important to understand that it doesn't just happen for no reason, okay? So this is going to be something that's also very crucial to understand. But where to have your semen analysis done is already a very important point. Now, this is the second important point, is that when you go and have it done, there have to be very specific things requested in a semen analysis request. If your doctor just puts semen analysis, that is all that is going to be done, which typically includes the bare basics, which is, you know, what's the volume, what's the concentration, what's the motility, the morphology, the count, is it progressing? Some labs don't even actually, in terms of motility, some divide it up. Some basically will rate the sperm in terms of rapid, forward moving, or just, you know, kind of not moving at all. Other labs will just basically put it all in one bag and just say motility, this score. Not very helpful, because you can have sperm that's moving, but that's not progressive, right? So they're moving on the spot. Guess what happens to sperm that's moving on the spot when it actually has to travel forward to get up a canal and go through many obstacles to be able to get through an egg? They don't make it. Okay, so just because they are motile, just because they're moving, doesn't mean that they're actually moving in the right direction. Sometimes they're even moving in the opposite direction. Again, not ideal. Okay, so, and again, this is why it's so important to understand when we're looking at a semen analysis result, when we're looking at different parameters and we're breaking it down, we need to then be able to really understand what are we talking about and what is this result actually mean? What has actually been requested here? And what I mean is, when we go again to an andrology lab as opposed to just a general pathology lab, you're going to get much more detailed information, even from a simple and basic semen analysis result. Okay, so that's something that you do need to understand, because if you don't understand that piece, you're going to go and have a test done that has very little in it, and your doctor will say, yes, everything is normal, just keep trying. And actually, the sperm are not even moving forward. But we don't know that because there's only motility, X% on that report, okay? So all of these pieces are going to make a difference. Also, the vitality percentage of sperm within a semen analysis is really important to understand, because if the majority of them are dead, we have problems, okay? And even if we're looking at IVF and ICSI, we're still going to have problems. So, you know, we need to be able to understand what all of these pieces mean, even if we're thinking and considering that perhaps we might do other tools, strategies, techniques, ways of conceiving and getting pregnant. Because it doesn't just translate that, you know, we can bypass everything with technology. Unfortunately, it's just not that way. As much as we would like it to be, it just isn't. So, this is something that's important. But, the next kind of piece that you need to understand is that as I said, when you go and have a semen analysis result, unless there's some other specific things that have been requested, you will be pretty much in the dark about DNA fragmentation, about sperm antibodies, and about whether there are infections or microorganisms present within that particular sample that could also be negatively impacting not only the health of the sperm, but also the health of the female partner and the ability to actually not only conceive, keep a healthy pregnancy to term. So all of these factors are going to make a huge difference in understanding. So what is sperm DNA fragmentation? Well, this test basically measures the quality of the sperm DNA package within that carrier, okay? And therefore, it's going to be a really significant parameter to analyze, because it's going to be telling us, okay, the sperm can swim, there are enough of them, and they're kind of relatively well shaped, and that's fine. But if the DNA fragmentation, if the DNA packages within the sperm are actually broken, fragmented, destroyed, not how they need to be, guess what's going to be happening when that sperm gets into the egg? Probably not very much, right? Because it's going to be too much damage for the egg to be able to resolve in its own right. And that's based on, what we've talked about earlier in the talk today. So if you've just joined me, start at the beginning. But basically, this is going to be really important. So there are different parameters that happen to be important when it comes to DNA fragmentation. And DNA fragmentation is definitely going to be one of there are meta-analysis done on this topic in terms of being able to see the impact of a certain range of fragmentation and the inability to actually get pregnant and take a pregnancy to full term. So these factors are now well understood. They're not yet necessarily fully translated into application in day-to-day patient care. Unfortunately, from the science to the actual recommendation that patients receive can actually take between 12 to 17 years, depending on what paper you read. So translation of medicine, even though, we know so much, and I mean, obviously from our perspective, we are certainly at the leading edge in terms of the lifestyle factors and the things that you can do, and looking at all of these different aspects, the majority of clinics out there that kind of just improve people's health, they're really, or who kind of, do some fertility work, they're really looking at kind of the general population kind of, situations that aren't very specific to what's going on. But also, even to a certain extent, a general primary practitioner or primary doctor, they won't often be completely fully in the understanding or the knowledge of what it is that you need to know about your fertility, because that's not what they're specializing in and seeing all of the time. So you may not even have had this conversation with your fertility specialist as a result, because, they're very focused on the IVF process and the amount of drugs that you're going to take to actually take you through that particular cycle, but not necessarily looking in the periphery of what else can be done. And it's great that you're here, because you're asking those questions. You're asking the questions of, okay, what else, how else, who else, so that you can change the situation, the circumstance from this point onward. So when it comes to DNA fragmentation, what we need to understand is this, that there is a range where there will be some fragmentation. Not every cell is perfect. The majority of cells within the body are pretty well formed, and they will be replicated in a pretty, well replicated kind of way that you look at it, you go, yeah, okay, they're pretty much the same. But then there are faults that happen, right, throughout that replication process. And this is very much what we're talking about here in terms of DNA fragmentation. So there is an expectation that there will be some fragmentation in the sample. We're not expecting that it's going to be an absolute perfect case scenario where every sperm is going to be perfectly formed and that it's going to actually be, perfectly non-fragmented in terms of its DNA. However, that is what we need to make sure that we qualify. So in terms of what is excellent and what is most ideal, The range goes from 0 to 15, but like I said, it's very unlikely that we're going to get 0. Okay, 3% is like the lowest that I've seen. So, you know, typically when we're looking at 3 to 15%, we really are looking at, okay, this is great in terms of DNA fragmentation. There's only 3 to 15% of the sperm that's actually not the best in terms of its DNA. There's a lot of fragmentation happening within this DNA. The rest of it, the 85%, is actually pretty good. Okay, so that is reasonable, that's acceptable. Anywhere between 15 and 30% fragmentation, we are already kind of like decreasing the quality level, and that's looking good, okay, but certainly not ideal. And so when we're looking at fertility and we're looking at all of these different minor factors that I was telling you about, you see, one minor factor is enough to give us an average of, 2 years time to pregnancy. So if that's the case, we need to start looking at, okay, it might be minor, but what's the minor aspects here that I can be improving? So if I can take my sperm fragmentation from, say 25% down to a 12%, that's already huge. Because all of a sudden we went from good sperm fragmentation to excellent sperm fragmentation, which in some cases that can be enough of a shift to get a very different result. So we need to start taking all of these pieces into consideration, that little bit by little bit we can actually make a very big difference in terms of reproductive outcomes. So 15 to 30% is good, and then anything above 30% is not ideal. But there are different ranges, and so normal in some other labs is considered anything below 20%. So 20%, essentially in our clinic, we ideally want to see around the 15 at the very most, because we know that if we have anything above 15, we're already starting to detract from the overall, ability to create a result that we want to see. So we're really, for our patients, we're really focused on making sure that if we've got fragmentation that's above 15, that we're really doing everything we possibly can to decrease it, okay? That's ultimately what it is that we're looking for, and how it is that we're working to ensure that we address and certainly adapt to what's required to get a different result, okay? So that's essentially, let's see if there's any questions from you guys at this point. I think everything is looking good so far. If there are any questions, let me know, and I'll be more than happy to answer them. And then, there's lots of different systematic analysis actually that have been done. There was one done last year that showed the association between DNA fragmentation and recurrent pregnancy loss. So, all of this, we know that if we are increasing fragmentation, we're going to be increasing reactive oxygen species, which basically is oxidation within the sperm as well, so that decreases its quality. And in the long term, typically what will happen with sperm is that you will see fragmentation be worsened before you'll see other parameters be worsened, like your motility count and morphology, because ultimately that's something that's more subtle typically, and it happens in a way that is going to, it's not as, let's put it this way, anything that's kind of not going right within the body, okay, is more difficult to detect than, for example, a missing limb. Right, you're able to very clearly see a missing limb, or somebody that has, a deformed hand or a foot or something. But basically, the same applies with sperm. It's more subtle what goes on into that DNA fragmentation piece versus, a sperm that has two heads or two tails or is misshaped completely. So that's why we need to be able to take this into consideration and question and ask, okay, well, if this is already happening, it's a sign of something that I need to improve and optimize, then what else could I be optimizing as a result of really focusing on this area? Because those pieces are going to be vital, okay? And again, that's the how to optimize all of this. Definitely go and look for the male fertility talk that I did in October 2019, because in there I talk very much about the how. So that will definitely be the thing for you to take into consideration and check out. But one thing that I will say, and I mentioned this before, in terms of drinking, smoking, doing drugs, whatever, right? Even if it's a little bit, what is a little bit? If I was to give you a little bit of rat poison to drink because it was cool and it tasted kind of interesting, would you accept it? That's my question. You know, to my patients who often say, but I can't stop drinking alcohol. Well, really? Because it is teratogenic. We know that it causes birth defects. We know that it causes anything that's teratogenic, by the way, is going to create a birth defect in sperm. Okay, so it is going to impact this motility, morphology and count at some point. It will also potentially negatively impact the ability of the body to make sperm to begin with. So depending on where it is that your body is most affected. I talk about this often because, you know, I often get the question, and have for many years, this question of, yeah, but you know, my brother and sister's husband and, you know, father or whoever, they drink, they smoke, they do drugs or whatever, they've got 10 kids. You know, why is it that I have to do all of this? Well, the reality is this, and it comes down to what's called the science of epigenetics. Epigenetics basically is the science, you know, we all know people who have never smoked a day in their life and die of lung cancer. And then we know the people who basically are chain smokers and have never had a problem in terms of cancer at all, right? They die of something else. And typically the reason that that happens is because the body responds differently to different stimuli. So just because one person is affected by smoking, by having lung cancer, doesn't mean that every single person who smokes will be affected by that same drug in the same way. What happens to this conversation in terms of that is this. So some people's sensitivities or, you know, kind of system I guess, function can decrease as a result of drugs. And for some people, what will happen is, in drugs in general, right? So we're talking about alcohol, we're talking about smoking, we're talking about illicit drugs, you know, drugs in general. Even environmental factors, you know, like toxins, pollutants, heat to sperm is going to be very problematic. And so what happens is that for some people, those same stimuli, they will affect other parts of somebody's body. So for some people, it will affect their motor neuron ability. For other people, it will affect their digestion. For other people, it might affect, you know, you name it, some other system within the body. For others, it will affect their reproduction. So when it comes to, you know, but my ex, brother, sister, dog, whatever, does this and has 20 kids, right? That doesn't mean anything, because what's happening for you is really what you need to consider. It's like, if there are factors and if life demonstrates that despite living in this particular way, it's not quite giving you the result that you want yet, we need to then look at, okay, what will? And that really is what it comes down to. So it's about looking at, figuring out what's happening for you and what it is that you need to do about it. There are plastics, you know, plastics are a huge problem. And plastics are found in most things, you know, from deodorants to clothing to food, you know, food wrapped in plastic, to water bottles that are made out of plastic. You know, so looking at all of these places, because all of these places, they will increase that oxidation of sperm. And so what's going to happen is that the DNA fragmentation is going to continue being at a high level if we don't look and address all of these different aspects. You know, one of the things that we ask people to do in the Fertility Challenge is to consider and look at the chemicals that they bring into their environment in the form of cleaning products. Make no mistake about it, when it comes to xenobiotics and when it comes to chemicals that are endocrine disruptors, those absolutely qualify and they will impact male fertility. But what's also important to understand is that all of these lifestyle factors are not the be-all and end-all either. There is the biochemical piece that also needs to be addressed, because if you're doing all of the perfect lifestyle things, but then we're still not addressing the biochemical impact and what's happening inside the body by doing very specific targeted therapy, then basically, you know, for many times I hear, oh yeah, but I've changed all my cleaning products, or I've changed my makeup, and I've changed, you know, my lifestyle and diet and everything else, and I still don't have a baby. Well, yeah, because there is more to it. And so being aware of that is the first step, because then you start to be able to actually question and go, okay, let's systematically and methodically address what else is left. Where else are the gaps? Where are the places of opportunity? So asking yourself those questions as well is going to be absolutely key when we're looking at, you know, treatment. So Sperm fragmentation is pretty much something that we need to take into consideration. It is even more a problem for people with vasectomy reversals, with varicoceles. Varicoceles can be quite problematic, often need to be, depending on which side and how big they are, they increase heat and the inability to actually remove blood and toxins from the testicles, and therefore can negatively impact the quality of sperm on many parameters, and including DNA fragmentation. But also count, motility and morphology can be impacted. So we need to always look for and address varicoceles where they may be present and where it may be necessary. Okay, so this is something that's really important. Now, let's talk about the second big idea, which is anti-sperm antibodies, because this is one area has been controversial for many years. However, what we find in the practice in my clinic is that whenever we find sperm antibodies, we do every possible thing we can to treat it. Depending on the sperm antibodies that we're talking about, whether they're IgAs, IgGs or IgMs, and where they're found, because they can be found to the tail of the sperm, they can be found in the mid-piece, they can be found on the head. Depending on where they're found, either it's going to make the sperm clump or not be able to swim properly or not be able to penetrate the egg and fertilize the egg effectively. And because this is all related and due to immunological aspects, then it also has an impact, again, if we look at that biochemical chain reaction, we need to question what else could be happening here and why sperm is affected in this way. Sometimes it can be because of trauma, sometimes it can be because of infections in the semen that are silent and haven't been picked up. For a lot of men, sexually transmitted infections are silent, completely silent. They don't know they have it at all until a sperm culture is done and is found. And if it's found, ureaplasma, is a huge thing. Mycoplasma is going to be problematic. Obviously all of the STIs are going to be problematic in terms of sperm quality and sperm health, but also female ability to keep a pregnancy to term. Sometimes it's not even that you're not conceiving, but what's happening is that because of certain factors, and if they're not ruled out, we can't say that they're not present. Because of certain factors, what will end up happening is that the inability to keep that embryo developing will lead to an early miscarriage, even before a pregnancy test is actually positive, or even a very early kind of chemical pregnancy or an early miscarriage to begin with. So you see, all of these factors will play a role, and that's why we need to then start to question and qualify, okay, how problematic is this? And if it is problematic, what do we do about it? For my patients, personally, I prefer to see 0 in terms of a number for sperm antibodies, right? But anything to do, kind of like out there. and by the way, what we often see is that when we treat patients, and optimize every aspect of their health, and in our clinic, we use mostly herbal medicines and nutritional supplementation in order to do this type of treatment, we actually see incredible improvements in terms of the sperm antibody reading and rate and range within our treatment of our patients. So it's very possible to address, and lifestyle factors here will also make a very, very big difference. So being aware that, when we're looking at oxidation, when we're looking at the things that are going to create DNA fragmentation, that they can also exacerbate the presence of the immune system around the reproductive area and reproductive regions is absolutely something that we need to take into consideration. And that is why addressing all of the factors combined, not just going, oh, okay, well, this is a little bit of a problem, like, the morphology is a little bit problematic, and the DNA fragmentation is also a little bit problematic, but overall it's okay. Honestly, if you're not yet holding the healthy baby of your dreams in your arms, it's not okay, because what that's telling me is that those things are compounding. And then you add not just what's present for you, but then what's present for your partner as well, and all of a sudden we end up with more of the same that we've had before. And this doesn't matter, again, like I said, whether we're talking this in terms of whether you're conceiving or trying to conceive via IVF or naturally. It doesn't matter. And this is the vast majority of reasons as to why IVF doesn't work. People think that they can actually take an abnormal result and go, okay, I'm just going to go and do IVF now, and try and bypass that biochemical chain reaction that I was talking about. Well, the reality of it is that unfortunately it doesn't quite work that way. It would be nice if it did, if we could just kind of like pretend that it doesn't exist and do whatever it is that we want to do and take the shortcut. Unfortunately, shortcuts are not so great when it comes to this. So putting in place the things that are going to make a difference overall is going to make a difference to all of those areas, not just one. And so understanding what else is there is important, so that you can really kind of have a sense of the fact that you're doing this, not just because you were told your sperm is fantastic, but because there are things that you cannot see within that, that report that are actually also going to be getting in the way. Now, unfortunately, Instagram is going to finish. I always end up doing this. I talk a little bit too long. We are going to be, I promise, we're going to be done in the next 5 to 10 minutes. But if you are wanting to finish this talk, you're going to have to jump onto Facebook, because literally we have 1 minute left on Instagram, and then it's going to say bye-bye. So anyway, we'll continue here just very briefly in terms of what it is that we need to do. So sperm antibodies is a very important thing. It affects many aspects in terms of the penetration of sperm into the mucus, into the actual egg. It affects, if it's in the midsection of the sperm, it will affect capacitation, which is the ability of the sperm to actually penetrate the egg. Also, depending on where we're dealing with in terms of sperm, like I said, it will affect the binding of the sperm to the egg itself. It will affect its ability to swim and even get to the egg. So, sperm antibodies will have lots of different, issues and negative impacts in terms of fertility and the ability to conceive. Lots of interesting meta-analyses have been done around the effect of sperm antibodies on sperm concentration and motility. So that's also something, I'll just make sure, yeah, there we go. So that's also something that you do need to take into consideration, is that these antibodies, even though the majority of clinics don't know what to do with them, they just kind of say, oh, let's just wash the sperm, that's going to be fine. Not quite, because if there are antibodies, we then need to be asking, how else is the sperm changed internally in a way that we can't see as a result of this, and how much could that be impacting the ability to not only conceive but take a healthy pregnancy to term. So all of these factors do need to be taken into consideration. It's not just a matter of like, oh yeah, nah, sperm antibodies, it's fine, we can just wash the sperm and it's going to be okay. Those things do need to be taken into account as well. Now, sperm antibodies very, very often, in fact, it's very uncommon for a man not to have very high levels of sperm antibodies when a vasectomy has been performed, or a vasectomy reversal in particular has been performed. So what happens with that is that that's due to trauma, the trauma of either cutting or clamping or burning. Seminiferous tubules will cause damage in terms of sperm and the ability of that sperm to then be as healthy as it can be. In some cases, depending on what it is that we're dealing with, it may be enough to address the sperm in a way that is going to optimize health and minimize and decrease the immune system impact to the sperm. But what happens is that it really will depend on how we then proceed from that point on. Because, for example, there will be some situations where we've had a vasectomy reversal and that we're going to need to collect sperm in a different way. That's also going to be having an impact, when it comes to the ability of then having that sperm even be successful through IVF, where we're putting a whole lot of sperm into a petri dish and we might not get enough in those cases, and then obviously allowing that sperm to be able to fertilize the egg on its own. In those cases, it might actually be the best approach is going to be to optimize everything to do with that men's health, really optimize and decrease the immunological impact, but then we still might need to apply ICSI after we've done all of those pieces, because it's the best way that we're going to get the result. So there is no such thing as the wrong approach. There's just a wrong approach to to a wrong situation, so to speak. So it may still be very much that, in a situation like this, after all the minor factors have been addressed, that's going to be the very best thing to do. But certainly I don't believe that, just kind of trying to bypass an issue is going to be the way to get the outcome that you're looking for. So ASAs, anti-sperm antibodies will definitely increase inflammation around the testicles, because that's where the sperm are, and of course that can cause extra reactive oxygen species, so that oxidation is going to also be exacerbated. So as a result of having sperm antibodies, we're also increasing the risk or the impact to DNA fragmentation. So all of these things are almost, there's like this combined, there's no such thing as, like you've hit your toe. Yes, you might have localized inflammation there, but your whole body is going to be mobilized in a certain way to actually deal with that trauma. So for example, there's fight or flight. Well, you've hit your toe, there's definitely an increase of adrenaline, noradrenaline, cortisol, all of these hormones then just, kind of come up to the fore all of a sudden. Even if you were in a nice, relaxed way, of course, there's going to be a whole lot of things that happen locally to that toe, and there'll be inflammation, there probably will be bleeding, there will probably be the immune system really getting in there and trying to make sure that there isn't so much, bacteria or viruses or whatever coming in and creating havoc to the rest of the system. So it will localize its impact, but the impact is felt in the whole entire body. The same thing happens when we're talking about reproduction and fertility. So the things that you put in your mouth, that you eat, that you breathe, that you put in your skin, all of these things will have an impact on everything else within the body. So that's why it's important, when we talk about what it is that you can do everything you possibly can to be the healthiest you possibly can be, because that really ultimately is what's going to be optimizing the chances of not only getting pregnant, but again, continuing to be pregnant and being able to take home a healthy baby. So these are all factors that you do need to consider. And mind you, anti-sperm antibodies is not a test that is done out of routine. So basically it has to be requested specifically, and some labs even ask you to request specifically the type of anti-sperm antibody that you're actually wanting to see. So it will ask you to specifically, to specify IgA, IgG, IgM, right? So you need to make sure that your doctor is aware of that, because sometimes they're not. And then finally, the third big idea today is about what I've mentioned earlier, which is sperm culture. Making sure that you have a sperm culture done is absolutely vital. I cannot emphasize enough. Most clinics do not do a sperm culture. Certainly from my many years of working in this field, I often find that more often than not, a pathology lab that just does general semen analysis, they will not simply, it's not part of their protocol to have a culture done unless it's requested specifically. And most doctors either forget or don't see the value, but the reality is that if you've been trying to conceive for more than 2 years, have tried lots of things and it hasn't worked, or you already know that there is a sperm problem, then you want to be able to find out, okay, why is this happening? And part of that, answering that question, is making sure that you know that there are no microorganisms creating local havoc to the immune system through the testicles, and of course affecting the sperm as a result. If we have infections in the semen, found in the semen culture, what's going to happen is that is absolutely going to increase sperm antibody, the risk of sperm antibodies, and the DNA fragmentation. So if already we're seeing that those two things are present, we really need to rule out infections. And like I said, mycoplasma, ureaplasma, gonorrhea, syphilis, all of those things are definitely going to make a big difference. So we want to make sure that whatever it is that we have to rule out all STIs always, and via urine, via blood, and of course by doing a semen culture. Even if you've done a urine and you've done blood and those have come back clear, It doesn't matter. You still need to have a semen culture because different microorganisms, E. coli, there's lots of different microorganisms that will overgrow in that culture that will negatively impact the ability to conceive and to keep a pregnancy to term. So you do need to make sure that you are requesting that. That is not something that is done just, out of anywhere or nowhere. And that's going to definitely make a difference. In terms of immunological aspects in general, so this is essentially also where we need to be looking into, okay, what are some of the things that are going to impact sperm? Ultimately, anything that impacts the body can impact sperm. It's that epigenetic situation that we've talked about. Sometimes we'll be able to see a direct correlation to that path. Sometimes it's not. Sometimes it's indirect, and sometimes it's like secondary or tertiarily indirectly, where, this impact here will cause something else that will cause something else that will then have an impact elsewhere to reproduction. So it's about understanding all of these factors, that it's not always going to be a direct line, okay? But asking for those 3 tests is going to be the first step towards having better clarity. And mind you, there's still so many other tests that we will ask for our patients. Like one of the things that I often see in my clinic is that when I get results, if I do have a semen analysis, amazing. If I have a proper semen analysis, oh my God, I am just like in heaven. If I have bloods, oh my God, I literally died and went to heaven, right? Even any bloods, because what happens is for most men, unfortunately, they get, if anything, you get a semen analysis, and it's a very basic one. There is nothing else looked into in terms of these factors that I'm talking about today. And certainly bloods, it's like, oh, sperm is fine. Who cares about the rest of your body? I don't know, that's not how I approach it, but I see this very frequently. And often we find things like, how many times we've found men with specific, thyroid conditions and, that essentially, as a result, impacted sperm, and it wasn't actually understood until these tests were done and we were able to see the results and go, oh, okay, well, now that makes it, and then improving thyroid function and doing all of the other factors in terms of lifestyle, environment, and everything else, we see a huge improvement, even though this person was really healthy before. Didn't drink, didn't do drugs, didn't smoke. So, it's about looking at the whole picture, and I think that often that gets ignored. So just be aware these things, being aware of these things, being able to have these conversations at a different level with your practitioners, or asking for a second opinion is going to be essentially what's going to change the situation for you. So I highly recommend doing that. Couple of little announcements before we finish up for today. AGR, Ask Gabriela Rosa live events, have been happening weekly for a very long time, and they are now going to monthly. Yay! Well, it's yay for me because, trust me, it's a lot of work to prepare for these talks. And it's great, and we want to bring you with the handouts themselves and all of the research that goes into making sure that you get the latest information is definitely going to be continuing, and it's going to be continuing on the monthly basis. So I definitely will love to do that. Oh, look at you, Magali, I love you. So I will love to make sure that you guys continue having access. The next talk that I'll be doing is actually going to be on age, infertility, and miscarriage examined. So be sure to signal your interest on the Facebook page, because what then Facebook does is it reminds you of the next talk. Also, you can post questions. If you have specific questions about that topic, go ahead and post them under the event, because it's great, and then I'll be able to answer them for you during the event itself. So that's one announcement. The other announcement, of course, is if you don't yet have a copy of Fertility Breakthrough, what I do want to say about this book is that we have now put together a Facebook group for people who are owners of this book only. So you have to provide, in order to get into the group, you have to provide proof of purchase of the book or a photo of yourself with the book if you were gifted the book, because I know lots of people have bought books to give as gifts. So as long as you have you and the book next to you and a photo sent to the team, they will give you access, or proof of purchase. Either one is going to be perfectly fine. So make sure that you do that. And oh, the other thing, hey, If you want to get a copy of the book, what I would ask you to do is share this talk. If you share it and you just send me a private message just to the page, and basically just share a screenshot of your private message, we will send you the book for free. Otherwise, you can go to Amazon or you can go to our website and buy a copy for yourself. So that's essentially what you need to do if you want to get a free book. And let's see what else. Let me see if there's any other announcement here. No, Fertility Challenge is coming up April the 8th. We kick off, so just about 2 months until the next event. And finally, if you're looking for personalised advice, if you're looking for someone to assess your case, that someone being me, and be able to tell you where are some of the places of opportunity, some of the gaps, I'll be more than happy to do that. You just need to go to thefertile.me/chat for making that appointment. That's thefertile.me/chat. My team will have a discussion with you to figure out if we can be of assistance. If we can, then they will basically organise an appointment for you to talk to me directly, and we'll go from there. So very well, thank you so much once more for your attention, for being here, for understanding that there is more you can do. I think that that is really the one thing that makes all of the difference in this journey, is knowing that there is more. And I want to leave you today with the knowledge that not only there is more, but it's more that you can actually do. And that ultimately is all you can do. Do your best, and that is going to take you far and beyond where you are today. So I hope that helps, and until next time, bye for now.